The need for an innovation like health coaching occurred to us early on, partly just by thinking about how overwhelming it was to try to deliver primary care in the modern era. Some research had come out of the Duke University Department of Family and Community Medicine showing that, to do just the evidence-based preventive care would take 8.5 hours a day. To do the chronic care would take another 10 hours a day. And you realize there was no way that even the hardest working family doctor or nurse practitioner was ever going to be able to meet those needs alone. So that was a need for a paradigm shift around health coaching. And I think there's two key elements of that. First is we need a team, not just people on their own trying to do this work. And we have to think about whether it's a medical assistant or a health worker or a nurse, but people who could start to, what we say, share the care of primary care and take on some of those responsibilities. And then the second key, I think, insight was we need to share the care, but we then have to deliver that care in a different way. And it's no longer enough just to tell patients what to do. We have to engage them in helping them define what their goals are for their own health improvement. So a simple, example would be the traditional way is to just give your usual 90-second lecture about, eat less carbohydrates and less fat and go out and exercise more. And we gave that speech time after time in a visit with a patient, and very little would change. It's a highly ineffective way to get people to actually change how they're taking care of their health.
When I first heard about health coaching, it actually made a lot of sense to me. I've had experiences and have read about a lot of positions in healthcare similar to health coaches. For example, the promotora programs throughout the country and especially in Latin America, the Barefoot Doctor program in China way back when. And so it was very familiar to me as a way of ensuring that healthcare got to the point where people lived or where people congregated or where people were thinking about in terms of their health care.
My relationship with health coaching, I think, is a little bit unique in that beyond working directly with the health coaches in the delivery of patient care, I was also afforded the opportunity to work more closely with health coaches. So in a COPD health coach study, I worked as both a consultant and also helped to support their training in COPD disease self-management. I think that the quality of care that I provided to my patients was improved vastly by health coaches. So first of all, I think my patients received improved quality of care through the education, the skills training, the follow-up and system navigation support that was provided by the health coaches. I think I also received a secondary benefit from watching the health coaches in action, in that I learned a lot of the communication skills that I felt enhanced patient engagement, and then brought that back to my own practice and communication with my patients.
Several years ago, one of the skills that I think was most helpful was working with medication reconciliation. Medication reconciliation is when a patient comes in, reviewing the medications the patient is supposed to be taking, going over the directions, seeing if they're taking them correctly, if they're not taking them, why not, finding out if there are any barriers or any side effects to the medications, and then presenting that in a summary to the physician or nurse practitioner or provider who's going to be seeing the patient when they come in to see the patient. That's extremely helpful, particularly in patients with multiple chronic illnesses who are taking many medications, sometimes 10 to 15 different kinds of medications that can be very confusing. So having that availability of a health coach, gaining that information before I come in and then summarizing it is extremely helpful and an efficient use of office time. Without the health coach, I could spend my entire visit just going over the medications with the patient and not be able to get to other issues the patient might be coming in with.
I can remember a patient who came to me, was transferred after his prior physician left, who had really terribly controlled diabetes and hypertension, and his cholesterol was not well controlled at all. And I think in the old days, my approach would have been, okay, we got to get your diabetes under better control, control your blood pressure, get that cholesterol down, and okay, we're going to change your insulin dose and change all your medicines and stop, eating so much sugar, and you really need to get to the gym or do something like that. Because I think that would have been kind of the traditional way, is we have to solve all these problems, and if I'm a good doctor, I'm going to make sure everything is, under control for this patient and make sure that the patient really knows what he needs to do. And the approach I took with this patient, because it was clear it wasn't just a coincidence that these things weren't so well controlled, was to ask him, which ones do you want to prioritize working on? Let's not try to tackle all three right off the bat. Which one do you want to start with? And he said, well, yeah, maybe the high blood pressure. I'm concerned about that. So we adjusted his high blood pressure medications and some of the behaviors around his blood pressure control, and his blood pressure control came under very good control. And then we turned to his cholesterol and decided, he'd be willing to try a different cholesterol medicine, and lo and behold, his cholesterol came under better control. The thing he really was not interested in working on much was his diabetes. The thing that gave him the most pleasure in life was to bake.
So the value in health coaching was very clear to me from day one of working with the health coach that I was assigned. Guillermo is his name, and he is somebody who is bilingual and bicultural, which is really important to the patient population that I work with. And he was able to work with several of my patients who were having difficult time really understanding what was going on with them and making changes. A situation that stands out to me is his work over several months with a patient who'd been struggling with having very high lipids, as well as having diabetes mellitus. And this is a woman who worked full-time. She had her own shop, as a matter of fact, and so it wasn't something that she could leave at a moment's notice, and it was very difficult for her to see specialists, and so she was dependent on our primary care to get the care that she needed. At the same time, because she was so busy and she was raising a family and she had a partner, she didn't always prioritize her own health. Guillermo built a relationship with her that I thought was really, really critical to her ability to make changes. And the things that he did seemed relatively simple. He sort of asked her, what she understood. He talked to her about what her conditions meant and what they might mean for her in the future. They talked a lot about what they might mean in terms of her children and her partner. They talked a lot about the medications she was on and side effects that she was having, and some which were related to the medications and some which were not. And then he did a lot of work between visits with her as well. So aside from the 15 or 20 minutes that we might have together with our patient, he often called her before the next appointment and made sure that she had medications that she needed, make sure that if there was any updates or any lab work that needed to be done, that she was aware of them. And so I think that helped her to feel really confident in him and to have faith in the fact that he was on her side. So based on that, she really made changes that I had been struggling with her to try to prioritize. They weren't big, huge changes, but it made a difference in terms of what her health outcomes will eventually be. I think additionally, because I learned more about my patient through Guillermo's work, I also made changes in sort of what I had expected her to do. That some of the priorities that I had related to numbers and levels and our report cards that we get from primary care in our family health center, that there were ways in which I could change those for her specifically so that it wasn't always a failure. And so that she could feel like she was building on her successes.
So there's a particular patient where I really saw the value of health coaching in my intern year. So a patient I met in the emergency room who had liver failure, didn't want to come into the hospital to get worked up and to get the treatment that we recommend for someone at that stage of their liver failure, decided to come in to see me a couple of days later. We had a little bit more time to start developing that relationship. and talked to him a little bit more in detail about what treatment would require and potentially procedures that he would need to make sure he was getting the treatment he needed. So there was resistance to that treatment and to those referrals initially, but I was able to actually do a home visit with this patient. And so through doing a home visit with this patient, I came to understand over the course of an hour just sitting and chatting with this patient that his father had also passed away from alcohol-related cirrhosis or liver failure. And that was a lot of the stigma and sort of angst that he had attached to that diagnosis, and some of the hesitation he had around actually being able to change the course of his illness. And so I think having understood that, having that relationship with that particular patient, that was where we were able to start building and moving towards getting him the treatment he needed. And now in my third year of residency, having seen him, he's stable on medications, he's gone through the different referrals that he needed, and he's been alive now for a couple of years on treatment and has been abstinent from alcohol, and just a perfect example where health coaching and really getting to the bottom of I think what the barriers patients face, as well as helping them identify the strengths that they have to be able to face those things, is really important.
One story that really reaffirmed the value of health coaching involved a patient of mine who has severe COPD and who continued to smoke pretty heavily. So he made clear early on in our visits together that he didn't want me to inquire about his smoking. And I honor that request, but after he was assigned a health coach, I was very pleasantly surprised to hear that he was able to quit smoking. And I think that resulted from the inroads that the health coach made with him, communicating with him how smoking impacted him and why he smoked, that really made an impact on him. So I was very impressed by that.
One in particular that stands out for me and has over the years is a patient, an elderly patient who had multiple chronic illnesses, was taking a lot of medications, was frequently confused and unsure about what medication she was taking, when she was supposed to be taking them, how she should be taking them. And I was also very confused about what medication she was actually taking. The health coach developed a relationship with this patient, a continuity relationship, so every time the patient came in, she knew she would see the health coach. The patient actually learned from that to bring all her medications with her so the health coach could review them with her. That was a monumental step in patient care with this particular patient. And it resulted in the patient taking her medications more as directed, helping us understand any issues she was having with the medications, and certainly provided another handle in improving her health and making sure she was taking her medications as appropriate.